Hi, this is Dr. Beretta, and I'm going over some hip, low back, and pelvic mobility activities that works best to start your day. We like to do these kind of activities after you do your primary warm-up, before again getting out of bed, windshield wipers, pelvic tilts, knee to chest. Those kind of activities kind of get circulation going. These are for mobility to help reduce inflammation and decrease pain. So I'm going to start out with a ball. This, if you have one, is a good activity, and again, primarily, I'm going to shift my pelvis and then I'm going to drive directly laterally into the ball. You should feel something over on the right gluteal muscles, and you should also feel some directly in your lumbar spine. Okay, and if I turn around, and again, I'm here, I position myself as neutral as I can, pelvic tilt, and then drive. So I'm just using a lateral shift. If a ball wasn't available, or you just have a ball, you can certainly do it like this and hold it for a little bit longer. Number two, we'd like your cat-cow, and then your knees and your hands are about the same width. You're gonna come up and down. Don't be in a rush. You can hold each position for more than just a second, and down. And then what we're gonna do is come together, arch your lower back, lateral shift. This should get into the upper gluteal muscles and your lateral hip musculature. And we're going to shift the other way on there as well. Again, maintaining the curve. Your third activity will go out at about 90 degrees. If you don't have the flexibility, you can start back, arch the lower back again, push back, and just do a little rocker. That rocker should be done for about 20 seconds or 20 repetitions per side. Don't be too aggressive. It's going to make you a little sore in the groin until you get used to it. That usually lasts about 2 weeks. Okay? On top of that, if we go out into a hand plank position, okay, I'm going to move to here, drop my knee in behind my ankle, and I'm going to go into an up dog. I'll hold that for as long as I need to, and then I'm going to go into a down dog. And again, 10 to 20 seconds is usually ample. If I need more stretch, I'm going to reach. I'm also going to shift. Okay, to the other side, here, 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 and then here. Okay, 1 to 2 repetitions, 10 to 20 seconds. Okay, so at this point, what we're going to do is we're going to leave our knees apart. I'm going to put the back of my hand on my hip, back of my hand, palm up, and then I'm just going to rotate. And again, I just primer my motion. I'm not going to go all the way on the first rep because I don't want to hurt myself, number one. Number two, I don't want to overstretch or strain. So I'm going to go 10 repetitions there, switch to the other side, 10 repetitions here. I leave my head with my shoulders, keeping everything safe, and going for lower trunk mobility and as well hip joint mobility. You can see how I'm shifting my hips to the side. We're going to go from there into the thread to needle, and then up to here. And again, I'm going to primer my motion to run this all the way through. And again, shifting my hips in order to get my hip and my pelvis involved. So it makes for a very complex and compound activity. Great for pretty much all activities. Okay.